Come on, guys. Good. Come on, hey, up here. Come on. All right.
Good evening, everyone. My name is Subha, and I'm the owner therapist of Capital Physical Therapy, and Taylor is a part of the team of Capital Physical Therapy. She has 3 years of experience in particularly women's health, and she's working towards a certification in women's health. Today, she'll go over prenatal care and some tips to help you do a little bit of exercises as well as things to consider during this time. Taylor, you can take it.
Thanks, Suba. Hi, everybody. Like Suba said, my name is Taylor. I'm very excited to do this one. It's the second part of a 2-part series that we've done. On Tuesday, we did postpartum. We do have that lecture recorded. So if you want that information later on in life, do reach out, let us know, because we have that all information saved. But also, happy late Mother's Day to everyone. Hope you all had a great weekend. So let's get started here. Let me share my screen. While I'm getting this set up, I'm going to let you know that sometimes I get going and I start talking fast. And sometimes I get going on tangents all over the place. Do feel free to unmute yourself and let me know if I start going too fast, if I need to slow down anything. Will not hurt my feelings at all. So, postpartum. Look at this. Where's the present option now? PowerPoint. Why can't I present this? We'll just go this view because I'm not sure why I'm having issues with technology today. Before we get going, I really like to start off with a brief little anatomy lesson. So this is a pelvis, as I'm sure you all are aware. At the base of your pelvis lies your pelvic floor muscles. Major systems that run through pelvis: urethra for urinary function, vagina for delivering babies and sexual function, and Uranus for bowel movements. All of these systems are so close together in that tiny little ring and significantly impact all of the other ones as well. These pelvic floor muscles, they go through a lot and take a lot of force throughout the course of pregnancy, throughout the course of life. We want to do things consistently through life that help support the pelvic floor, including strengthening the abdominal wall. We'll talk about that. But this is our little pelvis that we're going to be talking about. So, prenatal facts. Over the course of the 40 weeks during pregnancy, the body goes through significant changes with the growing baby, including weight changes as baby's growing, ligamentous laxity with all the hormonal changes preparing for delivery, as well as changes in posture and center of gravity. Along with that weight change, as belly is getting bigger with baby growing, we start standing differently to compensate for all the different forces. Physical therapy can significantly help you with aches, pains, and changes all associated with pregnancy. Things that we'll specifically cover in today's little talk is back pain, pelvic pain, changes in posture, prepping for delivery, and then tips for after delivery. Back pain. So a variety of contributing factors all can lead up to back pain. The abdominal wall weakness. With pregnancy, abdominal wall or abdomen grows with baby getting bigger, and it puts stretch on all those muscles. We want to continue to strengthen them throughout the course of pregnancy just to better support the system. Altered postures and center of gravity. Once we start standing differently to compensate for all these changes, it can also impact our back pain. Changes in sleep position. A lot of women come in saying that they have a hard time getting comfortable sleeping at night with all of the changes, and that can contribute to back pain as well. As pregnancy goes on, the breasts become heavier and it can lead to a lot of upper thoracic back pain, which can refer things into the hands as well, but we want to address those as well. So gentle abdominal wall and hip girdle strengthening is key, as well as movement as a whole. You really want to avoid holding your breath with movements. Just breathe. Exhale through your effort. It really helps a lot. Pelvic pain. Another big one that people come in to see physical therapy for is pelvic pain, either SI joint or pubic symphysis pain. We go back to our little model here. So SI joint being in between the sacrum and the ilium, and then pubic symphysis being where they connect in the front. They're all supported a lot by ligaments, and so all of the ligamentous laxity can lead to pelvic pain. The pelvis in particular really likes compression and it likes to feel stable. With the pregnancy changes and for prepping for delivery, it can lead to altered forces, which lead to pain. SI stabilization belts really are effective and very much help. There are some guidelines. You don't want to wear it all the time necessarily. You don't want to sleep in it, but it's great during the day while you're doing things. We can help get you information on this as well. Some people find that using a yoga block or a towel roll in between their knees in the middle of the night just to kind of squeeze against helps provide that compression just for rolling over to decrease pain. All right, let's see. Posture. So, as we've said multiple times already, posture changes are inevitable with the changes in centers of gravity. It can lead to back pain and tightness. And like I said earlier, it can get into tingling in hands. If you have it bilaterally in both hands, that is something that physical therapy can definitely help with. A lot of people end up with carpal tunnel syndrome throughout pregnancy, but if you have it in both hands, that could be indicated that it might be something from the back as well. It's important to continue to strengthen all of your postural stabilizer muscles just to better support the body in the movement systems. Altered postures can definitely impact your urinary incontinence. It can lead to increased pressure in your abdomen. It can lead to back pain, pelvic pain, and all the other things too. You do want to also be mindful of your posture post-delivery because it's hard. There are a lot of habits that we develop with posture. So after delivery, you don't want to stand back with arched back and kind of hunched over in just different positions. We want to address the posture after baby's born too. All right, exercises to prep for delivery. So a lot of people ask, what do I need to do to help prepare for delivery? Everyone is different, and I will say, like, I don't want to just give out generic exercise programs to everyone, but there are 3 big things that you can do. But do take into account, make sure it is safe for you to do exercise, make sure that your doctor is okay with these things. So the first one is sitting in a low squat like the girl in the picture. It's very hard to sit like the girl in the top picture, so you can do modifications to better support the body. It's one of those things, if it doesn't feel right, if it doesn't feel good, we need to change it and do something else. But sitting in that position is just a good pelvic opener, and it helps prepare the pelvic floor in good length tension relationships for delivery. So the girl in the bottom picture is actually holding onto a door just to get support or to be supported in that position. And then she has a yoga mat rolled up underneath her heels because it is important to make sure that your feet are down so that your toes could be picked up if needed. If all of that is too hard, you can always just sit on a low step stool and just be completely supported in that position. I often tell people start off with that and then progress to the other ones. Diaphragm breathing, which we'll talk about on our next slide, and pelvic floor relaxation and coordination is all very much key for delivery. All right, diaphragm breathing. Why is it important? So diaphragm breathing, your diaphragm, dome-shaped muscle sits at the base of your ribs. It's our primary breathing muscle. We are born breathing with your diaphragm. We just get out of the habit of breathing with it. So when you breathe with your diaphragm, inhale, there's a slight stretch on pelvic floor, slight stretch on abdominal wall. As you exhale, the abdominal wall engages and the pelvic floor engages. So it's a gentle abdominal wall strengthening exercise. And then it also works on coordination and co-contraction with the pelvic floor. So let's go ahead and do that real quick all together. So what I want you to do is breathe in through your nose for a count of 3 and out through your mouth for a count of 6. And on that exhale, you should really feel abdominal wall come together, pelvic floor lift up. And when I say pelvic floor lift up, talking about, imagine a string is just sort of pulling everything up. It doesn't need to be a forceful give it your all, just engage of those muscles. You should feel on your inhale, slight pressure, everything relax. This should be a good relaxing breathing pattern. It's easiest to appreciate that you're doing it correctly when you're on your back like the person in that picture. On your back, knees bent, make sure the motion's coming from your belly and not from your chest. All right, pelvic floor relaxation and coordination. It's not just about doing your Kegels. That's what so many people come in saying, well, don't worry, I'm doing my Kegels, I'm good. That's great, you're doing your Kegels, but it's not just about the Kegel. You want to make sure, one, you're doing them correctly. And when I say correctly, you want to recruit the correct muscles of the pelvic floor because a lot of people just squeeze their anus together and that's not good either. So we want to recruit the pelvic floor as a whole, string drawing up, and we want to do it relaxing and not giving it your all. A nice gentle squeeze and then relax. just to make sure that you do get that relaxation in there. To help with relaxation, a child's pose and a happy baby stretch, if comfortable for you and if okay for your body to do, are both very relaxing and can help with overall pelvic floor relaxation. If those two positions aren't comfortable for you, one exercise that I really like is if you're sitting at a table, put your forehead down, feet apart, knees apart, just relax and do diaphragm breathing and allow your muscles to just relax and kind of have a slight stretch, inhale and engage, and just to have a good fluid movement pattern. All right, tips for after delivery. You want to avoid straining, holding your breath with activity. No matter what you do, exhale through your effort. When we strain with different things, either constipation or something's heavy that you want to pick up, it just puts a lot of downward pressure on your pelvic floor, and it's not good for your pelvic organs. We've talked about a lot with abdominal wall changes and the stretch on those muscles with pregnancy. So we want to address the diastasis recti, which is separation of the abdominal wall commonly associated with pregnancy. Not everybody has a diastasis, but a vast majority of people do, and that's okay, but there are things that we can do to definitely address it and take care of it on the front end of things. You want to return to exercise safely. If you go from not doing anything to then let's go train for this giant run, it's going to be a lot of stress on your abdominal wall, your pelvic organs, and all those things. So we want to return to everything in a safe manner that's good for the whole system. Walking and diaphragm breathing are great exercises. Get good arm swing, and that's going to help engage the core. Avoid constipation because, like I said, that's not good for the pelvic floor. You want to drink plenty of water, and squatty potty posturing is wonderful. And that's just where it's about a 7-inch stool, 6 or 7 inches, that you can put underneath your feet, brings your feet apart, knees higher than hips. And it's just a great position for bowel movements. Let's see. So if you're interested in coming into physical therapy for these things, what do you expect? We start off with a PT initial evaluation, review all of your systems, medical history, current status, look at posture, range of motion, strength, all these things that we talk about. We want to start getting you on a good program to follow back up, just to help maintain pain levels, see what we can do to address all the things going on within the body, and then potentially follow up after delivery as needed. In conclusion, pregnancy and delivery, it has its big impact on the body. It's a wonderful thing, but it can, it stretches the abdominal wall. It leads to a lot of things, and we just need to take care of our bodies and address these things. In physical therapy, we are here to help with all of this. In the meantime, definitely work on diaphragm breathing and maintaining a good upright posture. If there is anything that you have questions about, my email is at the bottom. If you're interested in setting up appointments or anything, we do one-on-one sessions, not group anything. We just one-on-one you with a therapist. You can either schedule online or via the telephone number there. And like I said, my email's there. If you have any questions or if there's anything I can help you with, please let me know. Let's see. And so now, if there are any questions, please let me know.
Hello.
Hi.
I've been having some pelvic pain, and so you mentioned that the belt was a good solution. Are there any kinds of stretches I can do now while waiting for the belt?
So waiting.
Like time hurts and everything hurts.
Everything hurts. I'm sorry. So definitely diaphragm breathing, just to help start. It's not going to cure the pain, but it's going to help strengthen things around the hip girdle. And then, like I said, put a yoga block or roll up a towel and squeeze it in between your legs to see if that helps with any particular motions, if it's rolling over or related things like that. Just some gentle laying on your back, knees bent, and let your knees rock side to side in a pain-free range is a good one. Don't force pain or don't force a stretch. Keep it all pain-free.
Okay, thank you.
Yes.
Hi, this is
Hi.
Emily. Hi, Rachel.
Hi.
Rachel's my
Heather,
neighbor.
that's so fun.
Hi, Taylor. I have a question. So I have scoliosis. I have about a 40-degree C curve. So is there anything I need to watch out for? Any like special things I need to do?
So it's important throughout the course of pregnancy, do make sure that when you're standing, you keep your weight equally distributed, especially if you have a scoliosis. We tend to arch differently. Try to keep your weight evenly distributed through your feet and through your hips, not all cocked out to one side, just to help minimize additional stresses. And then also work on just rolling the shoulders back.
Yeah.
Definitely, because you don't want then the neck and then the upper back it's all connected. So really work on opening the chest with different activities.
Okay, cool. Thank you.
Yes. Any other questions? Let's see, I'll switch to that view. Well, like I said, do feel free, send me an email, taylor@capital.pt, if you have any questions. Suba also is here to help, suba@capital.pt. Let us know. However, let's see, oh wait, I see a question.
I just want to tag on to that, Emily. There's one thing that I give patients a lot that helps. So if you can put your arms like, raise up myself. So like palms like this and allow that openness to happen. Just go to the side like that. And it's not so much the low back that is participating in that, just your shoulder blades. So think about your shoulder blades moving downward and inward when you're sitting. So it's an opening of the collarbones and the shoulder blade and not so much the low back. So don't arch it, but just keep it and open it like that. And that's something that I give. And if you're working from home at this time, you know, periodically, once in 1 hour, once in 2 hours, just try to, you know, do it proactively instead of waiting at the end of the day to do it, because that's when, you know, it already built up and then you have just that tension that's building up through the day. So instead of that, if you already keep moving, then it'll help you, you know, overall. I mean, as Taylor said, decreasing the stresses that are associated with already your pre-existing scoliosis is the most important thing we have to do. So for that posture, improved strength, improved positioning with respect to how you work and your setup is also important.
Okay, great. Thank you.
Thank you all for attending. This, as Taylor said, we did it as a 2-part series for prenatal and postpartum. And we just, during this time, you know, it's a very difficult time and you cannot even go seek out care. So we're trying our best to give some information and some help that could be safely used by you guys during this wonderful time of pregnancy.
Yes.
Thank
Hope
you.
it helps.
Baby
We're always there, so reach out whenever you want. Bye. Take care.
It was nice to meet y'all.
Yeah.
Thank you. Thank you.
Suba, I have been asked, oh wait. Never mind. Oh.
Okay.
I thought that was. Oh,
You did very well this time, Taylor. I think